do capstone projects, and I have been going through, and I do come across a lot of mistakes as well, grammatical mistakes. So, one thing I really wanted to emphasize is academic English is very different from the spoken English. So, a lot of times one may be saying something, and on in academic way, it needs to be different. And that's why I will try to also introduce some of the things, that why is it really important to be able to understand medical English. Medical English is slightly different from the other general or common English, I would say. Okay. So I always really say it like this: information is power, because the respect any of the academics people they get is due to the knowledge, due to the information which they all are having. It's not due to, that they're a politician or something and all. So that's why I always respect that knowledge. And information is really important as well, because that is what decides what you're doing is correct or is it wrong. Do you need to do something and all as well. So it is easy to always go along with the flow, okay? That, yeah, everyone is doing like this. But sometimes when you have to try to go against the flow, that's where it becomes very difficult. Like, is it wrong? Is it good enough? Or something else needs to be done? Or what more you need to be doing, in fact? That's where really the challenge tends to happen, and we really have to think that is it correct, is something else needs to be done and all. And one thing is there in life, nothing is impossible. Always remember, if someone can do, the other person can also do. So always think about is, try to make your approach different. Once you have failed in life, I must say I have had a very good learning experience. So our EP program lead is Dr. Khalid Abuzgia. One of the important things really I learned from him is, uh, whenever you fail, try to do something different if you really want to succeed. So I would really like to say is never quit. The only thing is, like, you need to make your approach different. So this is what we will try to learn about and all. So what is collocations, in fact? Hmm. So what happens is a lot of times, okay, one simple question. I know there are a lot of MRCP students as well who are attending the lecture and all. Who all would like to, uh, you know, be in US or UK to practice medicine? Just use the chat box. Yes, no. Please use the chat box. Who all would like to go to UK or to US? Hmm. I can already see that there's a pretty good number, huh? So, so one important thing I wanted to say, see, normally everyone thinks like, for example, in UK, I'll try to give an example, um, that everyone thinks that it's only English. No, it's not just English. So they do have a lot of dialects, in fact. So that's where a lot of times it becomes a little bit difficult as well, not just to be able to understand. Admin's iPhone, I think you are drawing some lines on the screen. Please be a bit careful. These yellow lines, I hope you can see on the screen. So, what I meant is, everyone thinks like, okay, English is all the same. No. But what happens is the dialects. There are a lot of dialects. Even in just we all should be aware that it consists of Scotland, North Ireland, Wales, and England. These are independent, these are actually countries which came together to make this United Kingdom. Okay, so in these, all of them, they have their own accents and the way in which how they speak. A lot of times it can be quite a lot different as well. So if you can see over here, few people speak Welsh, then few people speak Cockney, East Anglian, and then Geordie, or even Punjabi. So 1.3 million people do speak Punjabi, or otherwise Gaelic as well. And there are a lot of people, for example, in North Ireland is Irish or Brummie in Birmingham. So they all will be slightly different. So that is one of the reasons. If you can think you can just manage with English, it's not the easy one. And in fact, yes, even if you will go to Microsoft Word as well, there's another English Indian. So, of course, there's English American as well. So, today I will try to limit it to the UK English. We will try to focus on that. Okay. So, it is very important for the good communication because it's our duty that our colleagues should be able to understand what do we see, what are we trying to convey as well, to help improve the quality of patient care and also to improve the relationship with your patient, because it's not good, even if you're a great doctor, but if you're not able to convey uh, your message to the patient, it's of no use. If you are not able to convey your good feelings to your colleagues, it is of no use at all. Similarly, it is very important, if you are trying to speak to someone, you should be able to have eye to eye contact and use an effective body language as well to have a clear communication. That's one of the other reason as well. For example, in UK, it's a common thing, consultation on an average basis. So, for example, if the clinic timing is, for example, for 6 hours, so on during that 6 hours, not 6 hours, I would say like 3 to 4 hours. So, in for example, 4 hours, they will not schedule more than 6 to 8 patients like that, because it is important uh, to have good enough consultation time as well, and then one should be able to listen well what are they trying to say. So, and always use the language that your patient understands and avoid medical jargon. So this is the quote from General Medical Council or the Nursing Medical Council as well, and it is a very important thing, in fact. Okay, so we will try to give some examples and let's see. Uh, okay, I'll give you an imaginary situation. You're practicing today in UK, okay? Huh? Please don't use these lines. Whoever has done that, please delete it. Who is this doing it? That's not good. Please don't interfere with the speed of the lecture. Yeah? Yeah, no, no problem. Thank you. So, yeah, so for example, if a patient, okay, as I said it today, you are doing a clinic, okay, in the hospital in UK. So the patient comes to you and says, "Oh, I've got really bad guts, doctor." What does it mean? So if someone says like this, what does it mean? So as I said it, I'll try to give some examples. So a lot of people they say, "Oh, it's so easy and all." So I'm giving you a typical example. A patient comes, you're there in the clinic you're there in the hospital. The patient comes, "Oh, doc, I've got really bad guts, doctor. Doc, so what does it mean? Hmm, I can see someone has made an attempt. What else? Try to think. Okay, something else. Hmm, do you know what actually it means? So, what it actually means is that I've got pain in my abdomen. Okay, now the next situation. I've been puking for 2 days. What does this mean? Indeed, so I have been vomiting for 2 days. I broke my collarbone 6 months ago. The patient says to you, so what does the patient mean if someone says like this? So collarbone actually is the name for clavicle actually. Now let's try to make it a little bit more interesting. I'm having trouble down below. What does it mean? Hmm? What does this mean? So it means is I'm having troubles with my genitals. So there is a lot of difference, as I said, it spoken English, colloquial English, academic English can be quite a lot different. So that's why a lot of times one may think that, oh, this is so easy and all. No, it can be quite a lot different, and that's where one has to be a little bit careful. One should be able to understand as well. Similarly, as I said it about my back passage. So back passage normally it refers to is the anus. Okay. Similarly, you're thinking of telling like, you want the patient to, you know, please inhale. Do you think is it a good English? Or what else? How can you make it better? What is the better way rather than telling please inhale? You're trying to do a respiratory system examination of the patient. How would you like to tell to the patient? What is the better way, I would say? Anyone would like to say? I would say please inhale is not a good way. Hmm. So better way is to say is please breathe in or take a deep breath out. Okay? So breathe in or take a deep breath. In fact, rather than telling inhale, inhale is not really a good term. So similarly, uh, you want to say administering an intravenous infusion. There's a patient. What is a better way to communicate this if you want to try to tell to the patient? Hmm? What do you think is the better way for this? So you should say, give your patient a drip. A drip is a better way. You know why I said it? Intravenous infusion is not a good way because you're trying to use is a medical term. Medical term usage is good, but the patient will not be able to understand. So that's why you should be able to tell the patient in the patient's own language or something which makes it easier for the patient to be able to understand. So that's the reason why it is important. Okay? So rather than asking where does the pain radiate, what should you be asking to your patient? Hmm. Come on. See, it's not like I would say like what is bad or good. The thing is, we have to know, what is a better way of speaking, what is a better way of communication, and that's what we all are here for, isn't it? And that's why we all would like to improve upon this, and that's why we are trying to. Hmm? So you should ask, does the pain go anywhere else? Okay, so this is a much better way of communication. Similarly, do you need an endoscope? What is a better way if you would like to communicate to your colleague or even to your patients as well? Hmm? So, what is the better way? I know, see, most of the people being doctors and all, they will be able to understand endoscope. But is it good? Is this how, if you say it to your patient as well? I don't think so. It is a good way of communication. As I said, it General Medical Council, which takes care for the medical care professionals, or even the NMC as well, Nursing Council as well. They don't like it like this. So you should be saying that we need to pass a tube with a camera into your stomach, because that's a easier way, and that is a better way to be able to communicate to your patients. So then, similarly, a lot of times, even when the patient is speaking to you, a patient may tell regarding your abdomen, like belly, tummy, stomach, guts. Similarly, if it is about umbilicus, patient may tell to you that about your navel, belly button, tummy button, and even to axilla, the patient can refer as armpit. The breastbone. Breastbone is the one which is refers to sternum. And the anus, as I already said it, the hole, the back passage, bum. And the larynx, some of the patients, they tend to refer it as the voice box, okay? Or trachea. Trachea is a normal thing which is referred with windpipe. So now something called is the symptoms. So symptoms colloquialism. So in which the patient may say something a little bit different. A little bit different. What I mean to say is, how do they say it? So if you will see this, you will be able to understand what I mean to say. So if the patient says like, oh, generally feeling ill, what does it mean? So patients say, oh, I'm generally feeling ill, doc. So feeling sick, not feeling well, or feeling poorly. For example, for diarrhea. Diarrhea, I think everyone understands the loose stools. Uh, Even, yes, some of the patients can say rather than diarrhea, shits. I'm getting 10 to 12 times shits, or runs. I'm getting 10 to 12 runs, or 10 to 12 trots. And for example, for the pain, any, any example, what do you think the patient may call it as? So it's not so easy to practice in UK, and that's where it does happen a lot of those times. The patients, I mean the doctors, if they are not able to understand, they have been put up into tough times. They will be referred. The patient will complain later on, I had said it to the doctor, but the doctor couldn't understand well, and you will be into problem. Or even to the nurses as well. Yeah, I had said it to the nurses, but the nurse didn't understand. So there's a problem with the nurse. And then you'll be like, what the hell? That patient never said it to me, anything like this. And you will be surprised, like, what? What are they talking? No, the patient never said it to me like this and all. When was that? What are they talking? So, what are the colloquial terms which you can think for pain a patient can be using? So, they can be saying, it's killing me, doc. It, it's sore. So you'll be thinking that, oh, it's sore means is he having a wound or anything? No, it means is he's having a pain. It hurts. It aches. It's killing me, literally. And for example, for vomiting, what will they be telling? vomiting, what do you expect? What do you understand? So similarly, yeah, to be febrile, so someone can be come and one can be telling, oh, hey doc, I'm burning up literally. And for example, similarly, for the nasal discharge, one may say, oh, I'm having snooty nose or runny nose. Even for the menstruation, one can tell, oh, doc, this is the time of the month. Flatulence, one may be saying like, oh, I'm passing wind, I'm farting. So that's why uh, it's not just the medical terms which we all learn. So one may be having complaints about the other ways as well. Tachycardia. So we all are aware, yes, it means fast heart rate. For example, for the palpitations. So one may be telling that, okay, I'm having a sensation of fluttering, a beating, or pounding as well. Similarly, paresthesia. A patient may say that the sensation of pins and needles. Okay. Then about intermittent claudication, so something like a pain in the legs while walking. Rhinitis will refer to the running nose. Okay. And as I had said, if someone says, a patient says like snuffles, snooty nose, it refers to the nasal discharge. And glossitis is the one which refers to the sore tongue. Or menorrhagia is the one which refers to heavy periods. So, so now from the history to the symptoms as well, I was trying to give you a flavor, what is called as colloquial English. So, especially being in the UK, whenever you're there, yes, one may not even really like to speak in that way. So, for example, if about this, for example, death. Death is the normal English which one will think of. So there are a lot of words about which people may not be able to, they are not comfortable. They are, really feel a little bit embarrassed to speak about. So that's why, if, for example, this is a very important thing being a doctor, that you may be even asked like to speak or communicate the death. So for the death, do you know what can your patient be talking to? Any guesses? What are the effective ways to say about the death, for example? What can your colloquial patient can be telling to you? So you will come across when the patient will be, kick the bucket, snuff it, go to Rose Cottage, make the maker, meet your maker, pop your clocks, tell me truthfully. So we have so many students right now who are attending. By any of these words, kick the bucket, stuff it, pass away. Pass away, okay, fine. I think most of the people will be able to understand. But go to Rose Cottage, meet your maker. Meet your maker is also like a little bit, okay, pop your clogs. We'll be able to correlate it with death. Do you think so? So it can be quite a lot different and difficult. For example, similarly for cancer, What do you think? For example, for the cancer. So even for cancer, really, so some of the patients will just say it like this: "Hey doc, I got the big C, something serious. I've got something serious, a growth, a lump, or a tumor." So similarly, yeah, someone may not be comfortable talking about their female genitals, so one will even just say is so down below, private parts, a front passage. So similarly, for example, for the female genitals, as we already learned, patient can be telling like down below, the private parts, the front passage. So the front passage and the back passage. I hope you understand now, okay? The front passage, the down passage, the big C, the snuff it. Okay, go to Rose Cottage, make your maker, pop your clogs. So similarly, there are a lot of medical abbreviations as well. Yeah. So how many, if someone is telling? So there can be a lot of different dialects as well to be which patients can be using, for example, for the numbers as well, and you will be pretty amazed. So, for example, when you ask your patient, uh, how much do you weigh approximately? So, you know, what is the common way of telling about measurements, weighs, especially in UK? A lot of those patients, you know, they will be telling like 12 stones, doc. What does it mean? 12 stones. So, as I said, it is a pretty common thing over here, and one stone refers to 6.35 kgs. Pound, we all are aware, 1 pound is 0.4536 45 kgs. Then one stone refers to 6.35 kgs. Okay, so if someone said 12 stones, 12 stones will refer to like around 75 kgs. Okay, similarly, we all are aware, yes, we, in our medical terms as well, we tend to use these words like the TDS, QID, Nocte. Nocte, anyone would like to say? What does it mean? Nocte actually means, and you will come across these terms. See, I come across whenever I'm working in these hospitals. And these are the common things which you all will also come across. Nocte. Nocte means in the night. It has to be given. BID, I hope you all will understand. ABG, ESR, chest X-ray, FBC, uh, then UNE. That was a pretty common confusion for me as well. Earlier, I used to practice medicine in Netherlands, but later on, like when I moved to UK, so I was like, what does UNE mean? UNE, anyone would like to say? What does it mean? So UNE refers to the kidney function tests. Okay. So oral glucose tolerance test, fasting blood sugar. So then uh, DOE is date of examination, DOA date of admission, no abnormality detected. WNL means within normal limits. Yeah. So what I mean to loss of consciousness, LOC, IBS, irritable bowel syndrome, AAD, antiarrhythmic drugs, UTI, urinary tract infection, DNC, dilatation and curettage, AKI, acute kidney injury, TBC. TBC is total blood count. So, what I meant to say is there are a lot of these terms which may sound a bit unfamiliar, and a good practice always is so, for example, if you're trying to send a patient for investigation, so if you're sending in a form, if you're writing in a form, always try to avoid these shortcuts because, yes, you will be able to understand, but not the other person. And that is why to give a uniform approach, especially for all the doctors, healthcare professionals as well. In UK, there's a law that everyone should appear other than the medical examination, but also